Okay. Well, thanks, Niall, and hello, everybody. It's a pleasure to be here. I wanted to start, Niall had said at the start it shouldn't be all doom and gloom, and that's a bit of a challenge for me because I think when you work on child rights and climate change, it's quite a sobering kind of area of work. But nonetheless, I will talk a little bit about some of the kind of grounds for optimism and opportunities I see as well. So maybe to start, a brief introduction to UNICEF, which is the UN Children's Fund responsible for providing humanitarian and long-term development assistance to children and mothers around the globe, focusing special attention on reaching the most vulnerable. And we're present in 190 countries and territories. And our mandate is really to uphold the Convention on the Rights of the Child, so the rights set down within that, which is the most widely ratified international human rights treaty. There's just one country in the world that hasn't ratified. I think South Sudan and Somalia were the last two in the last couple of years that did ratify. But sadly, the US is still not one of our members, and that's not a situation we see sort of changing in the next couple of years, probably. So the Convention sets down a set of rights which are specific to children, recognising their particular vulnerabilities and needs in addition to the human rights that are available to all humans. And it includes, notably in the context of today, the rights of the child to the enjoyment of the highest attainable standard of health, including that states should take appropriate measures to combat disease and malnutrition, taking into consideration the dangers and risks of environmental pollution. Now, the reason we talk about rights is because often when we talk about children, you know, they're sort of talked about in a narrative of most vulnerable sort of passive victims that we have a moral sense of duty to help and to provide care for. But actually, children are rights holders, and countries have signed up to obligations under international law to uphold their rights, including their right to health. So I think it's very important that we see them in that context. So today I'm going to speak about the impacts of climate change on children's health, why children are particularly vulnerable, some of the gaps and the challenges we have in terms of climate change policies on the one hand, not addressing children and their health, and then child rights policies, child rights focused kind of policy areas which don't take into consideration environmental risk and climate change. Some of the recent evolutions that have come about and the fact that this is an evolving situation under sort of international frameworks at the moment, that's quite exciting. And that's to counteract the doom and gloom. And then, if I have time, then just a couple of examples of UNICEF's work to kind of showcase concretely and tangibly what we mean by a child rights-based approach to these challenges. So to start with this slide, which is really intended to provide a snapshot of the multiple ways in which children's rights, particularly their right to health, is undermined by the impacts of climate change. And this is a quote from the president of Vanuatu following Cyclone Pam in March 2015. And he said, "All the development has been wiped out, we will have to start again," which I think encapsulates very well the scale of the challenge we're facing. Obviously, since then, there's been Typhoon Haiyan, we've just had the recent destruction in the Caribbean. So this really does pose huge problems. Now, the key starting point for UNICEF is that children are among the most vulnerable to climate change impacts, because childhood represents a unique period of rapid physical and mental development, particularly between birth and the age of 5. And this is when children's bodies are most vulnerable to the conditions that climate change exacerbates and environmental risks exacerbate. So for example, in terms of malnutrition linked to drought, so looking at crop failure, desertification, these kind of risks, this is responsible for nearly half of all worldwide deaths of children under the age of 5. And for those that survive, the impacts can be lifelong. So undernutrition in the first 2 years of life can lead to irreversible stunting, which Nick mentioned, which is low height for age. And it affects both physical and cognitive development. And the current state of play is already pretty dire. 25% of the world's children are stunted, rising to 43% in the DRC. And the president of the World Bank recently described the situation quite well. He said, "Inequality is being baked into the brains of a quarter of the world's children before the age of 5. So if you can imagine the implications in terms of their future health, their education, their livelihoods, the implications for entire societies, that's quite stark. And climate change is projected to increase severe stunting by 23% in Central Sub-Saharan Africa and by 62% in South Asia by 2050. So it's not really an overstatement to describe this as a sort of humanitarian disaster in the making, really, albeit one that's complex and not really being taken as seriously as it should be. Similarly, if we're looking at disease, rising temperatures, we've talked about, Nick was mentioning malaria, or the lengthening transmission season, and expanding sort of geographic range of vector-borne diseases such as malaria and dengue. And the global burden of these diseases is really concentrated on children. So in 2014, 78% of deaths from malaria were among children under the age of 5. Drought, flooding, more irregular rainfall patterns. These are increasing the incidence of diarrheal diseases, which is another major leading cause of mortality for children under the age of 5, responsible for over 500,000 deaths of children under 5 in 2015. Now, in the top right, you've got a picture of a severe weather event in the Pacific. And taking a more holistic understanding of health, the implications, both physical health, but also psychological trauma during and after these kind of events for children, and the events obviously expected to increase in magnitude and frequency with climate change. The implications of that for children are immense. Children are more likely to suffer than adults, to suffer injuries or to die in the context of these events. And in the aftermath, they're at heightened risk of exploitation, violence, and abuse, often as a result of family separation in the context of these events. Loss of livelihoods, which can lead to displacement and migration, or sort of separation of families in that context too. On the middle left, you've got a slightly more controversial picture, which is to do with conflict. Now, obviously, linking climate change to conflict has been the source of some debate, but there is increasing consensus that climate change does act as a threat multiplier in these contexts. And obviously, that has conflict that is well-studied impacts on child's cognitive development and physical well-being, and not to mention sort of availability for health systems and sort of infrastructure in place for them as well. And finally, in terms of the bottom right, this is a picture of children going to school. That's not fog, that's air pollution, one of the leading causes of child death globally, and plays a direct role in causing pneumonia, which is the leading infectious killer of children under the age of 5. Actually responsible for the death of children every 35 seconds, one child, which is killing more children than HIV, AIDS, and malaria combined. And children are more susceptible to air pollution than adults because their lungs, their brains, their immune systems are still developing, their respiratory tracts are more permeable, and pollutants that cross the blood-brain barrier can again affect their cognitive development, so lifelong implications there. And obviously this isn't just a problem that's confined to the developing world, this is very much a problem in the West as well. So that's a rather stark picture, but I think in addition to highlighting the fact that children have sort of a unique vulnerability because of their stage of development, it's important to recognise 2 other ways in which children are disproportionately affected by climate change. The first of which is that the regions and countries most exposed to climate change impacts tend to have a larger share of children as an overall share of their population. And that's certainly a trend that will be accentuated by demographic shifts in the coming years. So as a number, as a group, they're more affected. And obviously today's children will live longer as well and will experience increasingly severe and recurrent crises during their lifetime. So, the implications there in terms of the health burden, their future well-being, and health policies and costs as well is certainly something that needs to be taken into consideration. Now, the problem we see, one of the main challenges, is that children are really falling through the cracks. So the situation is that the relationship between climate change and children's rights has really not received the degree of attention that it requires in terms of coming up with policy responses. So children's rights have historically been overlooked in international negotiations under the UNFCCC. And the majority of national climate policies make little or no reference to children as well. The most recent round of contributions, nationally determined contributions to the UNFCCC, illustrated this quite starkly, I think. Less than 1 in 3 included reference to children, youth, or young people. And many of those references were really just very superficial in passing, so no sort of substantive analysis or sort of in-depth assessment of what was required. And on the flip side, policies and initiatives that address children's rights, notably healthcare, tend to touch superficially at best on issues such as climate change. And this is leading to a situation where there's a real lack of information and disaggregated data on the children most at risk and the measures required to address their specific needs. And that obviously has ramifications for programming decisions and budget allocations at the national level as well. So this is one of the key challenges that UNICEF is seeing and hoping to sort of bring about some change in this area to ensure that we're linking up these two sides of the house, absolutely essential for children's health. Now, at the international level, there have been some recent, I would say, evolutions, which are quite exciting. So recognition is evolving on the links between climate change and human rights, and child rights specifically, and often looked at through the lens of health. So numerous human rights bodies have made clear that states should protect against foreseeable environmental harm, including climate change. And notably, the Human Rights Council has been working on this. And these obligations can be categorized as follows: that states have an obligation to adopt measures to protect children's rights, including their right to health, from the harmful effects of climate change. And this should include both mitigation and adaptation action. And those measures that they take should be sufficiently ambitious to safeguard children's rights. And they also have an obligation to ensure that the measures they take, the measures themselves, respect and uphold children's rights. And that safeguards against situations such as we've seen with the building of green projects. So we're looking at major hydro dams, for example, in South America. There's been some examples where these are being railroaded through at the expense of local communities. So the intention may be good. We've had situations where local indigenous populations, for example, are being deprived of their land and access to water and food. In fulfilling these obligations, states also have so-called procedural duties, which are to assess climate-related impacts on children and make climate-related information available to children through child-friendly and language-appropriate materials, to uphold their right to participate and be involved in climate decision-making, and policy dialogue as well, and to provide access to effective and timely remedy for harm. And those obligations should also extend to the role of the private sector and harm caused by corporations in accordance with the guiding principles on business and human rights. And I think that's particularly relevant in the context of increasing amounts of climate finance being funneled through the private sector and their role increasing in that space. Now, the Committee on the Rights of the Child is the independent body which is responsible for monitoring implementation by states of their obligations under the UN Convention on the Rights of the Child. And they've gone further, and they've actually been very progressive in this space, and said that climate change is one of the biggest threats to children's health and exacerbates health disparities. States should therefore put children's health concerns at the centre of their climate change adaptation and mitigation strategies. Now, I can say safely at this stage that's certainly not the case. If countries are looking for guidance on how they should be addressing children and children's rights under their obligations within the context of their climate policies, then look no further, we have the guidance. And the committee often issues, so it does its reporting on each country every 5 years or so and issues very specific recommendations. Now, most of their recommendations to date on climate change have been to developing countries, but last year they did issue a recommendation to the UK government for the first time, issuing a recommendation to a developed country, including on climate change and linking this to air pollution. That's encouraging and certainly something that I've been using in my work with the UK government. Now, in parallel, there's obviously been exciting developments in the international climate change framework as well. So the Paris Agreement is the first ever international environmental agreement to explicitly recognise the importance of human rights obligations, including children's rights, in the context of climate change. And it says parties should, when taking action to address climate change, respect, promote, and consider their respective obligations on human rights, the rights of children, and intergenerational equity. And obviously, as the rulebook is being developed currently, we're yet to see whether that will actually be taken forward in the implementing decisions. And obviously, there's other relevant national and international standards that provide guidance for countries as well. The Sustainable Development Goals were mentioned, the Sendai Framework for disaster risk reduction, and both of these incorporate consideration of human rights as guiding principles. And they recognise that tackling climate change will be central for their achievement. And they also place emphasis on children's particular needs and vulnerabilities. So I think taken together, all of these developments do offer important opportunities to bring together these sort of siloed approaches to development, to children's rights and to climate change. The challenge has always been to bring these strands together and to translate those words into sort of urgent action required. And Niall had mentioned the Geneva Pledge. I mean, that's one initiative where we see sort of governments saying, yes, we recognise there's a problem here, there's a gap. At the national level, what can we do to bring together our national teams working on environmental issues and climate and health and rights? And how can we take that through to the international talks as well? I'm just going to finish then with a couple of examples from UNICEF's work to really illustrate what we're talking about when we talk about the child rights-based approach to climate action. And I've tried to select a few that sort of address health, although it's so cross-cutting. So the top left, we have a picture of Sudan. These are solar systems for pumping water. And the implementation has helped these vulnerable communities and school children in the Blue Nile region, which is afflicted by conflict, to obtain water supply at a reduced cost without the need for fuel generators. So obviously environmentally much more sustainable. And the project has contributed to 20% increase in access to water supply. And the availability of the water has also helped to reduce the burden on women and girls in particular, who have to spend, increasing amounts of time to fetch water from further and further away. In the top right, this is UNICEF Burundi, who have implemented a project providing children with safe, clean, and low-cost lighting. This is Project Lumiere, which enables community groups to purchase these pedal-powered generator and fast-charging LED lights to sell within their community, and that's expanding the time for children to study, but also reducing their reliance on the use of kerosene and firewood candles, which are harmful to their health and also to their eyesight. Also, from a child protection lens, they're more able to go out at night if they need to go out and see what's out there, as they felt very unsafe before, so providing lighting for the community more widely as well. And finally, the bottom left, this is a UNICEF program in Bangladesh, which is delivering more fuel-efficient cook stoves to households, helping to cut emissions, but also the sort of smoky environments that Noah was describing, which are catastrophic for children's lungs. And also saving families money and time collecting wood. These stoves require less fuel, and in the process helping to reduce deforestation and to limit local flooding as well. So there's just a few examples. Thank you.